In light of the unsettled issues related to the provision of free renal services at some hospitals across the country, the Komfanochi Teaching Hospital is currently holding an urgent meeting with top hospital administrators to discuss lingering challenges surrounding the delivery of the free renal service announced by the National Health Insurance Authority. The NHIA, in its efforts to improve access to dialysis treatment, issued a directive to provide free renal services, including hemodialysis, to insured persons suffering from the chronic kidney disease. Although the hospital has received official communication from the Ministry of Health and the NHIA, several factors impede the seamless integration of the program. Management is currently in a crunch meeting to decide on the rollout. My colleague Nana Boacheyadom joins us from the hospital with details. Nana, the hospital has an official directive from the NHIA. So what triggered the emergency meeting?
Well, Aisha, before the hospital can make a determination to roll out the free renal services for kidney patients at the Komfanochi Teaching Hospital, a lot of things or a lot of measures has to be put in place. Now, the major thing that they are considering is the cost of the dialysis treatment. Well, at the Komfanochi Teaching Hospital, a cost per session is 597.50 Ghana, that's Ghana cedis. And the hospital is thinking of how to absorb this cost and in a way to make sure that they are able to carry out the initiative in a way which will not affect the finance of the hospital. They would have to hold this emergency meeting to make sure that they have a number of patients who come into the hospital. They have the database of every particular patient who come in for this renal service, so as to make sure that the finances would not go into the account of the hospital, but directly absorbed by the National Health Insurance Authority.
So what are you picking from the meeting so far, Nana?
Well, one thing that we are picking is that the hospital is not starting the rollout this day, which is today, despite having the directive from the National Health Insurance Authority and the Ministry of Health. Well, the rollout is expected to begin somewhere on Monday, although they have the official communication. Well, that is what we are picking from the meeting as it's currently ongoing. Well, the Deputy Medical Director, who I spoke to before getting into the meeting, told us that it all has to do with the financing of this free renal service. Although they have the official communication from the Ministry of Health and the National Health Insurance Authority, it becomes very difficult for them to make a determination on rolling out, because the Komfanochi Teaching Hospital has a number of dialysis patients or renal kidney patients who come in frequently. Now, their daily session or the numbers that they receive daily continue to increase even after the announcement of this rollout. And so they have to make a critical determination on this particular issue, hence the need to have this emergency meeting. And so what we are picking now is that the hospital would not have the treatment for the patient today, but then from Monday it would be ongoing.
You visited the renal unit. What is the condition of patients as we speak now? Because yesterday you said that they had not started. Today, what's the condition?
Well, it is not different from what we reported yesterday. It is still the same. The patients are worried about the cost. One man that we spoke to yesterday says he has been there twice this week. And since he came in, he has been making the payments himself, which is very, very worrying to him. One person that we didn't speak to is within the range, that is in between 18 to 59. And she is also complaining that the National Health Insurance Authority and the Ministry of Health and government in general should also improvise and make sure that the two-month session for people in between 18 and 59 could be increased in a way. Well, most of these patients that we did speak to are worried about the cost of the dialysis treatment, and then the fact that it has been announced as a free session for them, but they still have to bear the cost.
Nana Boacheyadom is a man in the Ashanti region, Kumasi, monitoring this issue at the Komfanochi Teaching Hospital for us. We'll bring you more as and when we get it, especially from this emergency meeting in our subsequent bulletins. Now.